We can start now, sir.
Sonu.
Okay, sir. Good evening, one and all. A successful future belongs to those who believe in the beauty of their dreams. As we all know, the very old pharma professional organization of Kerala, Kerala Pharmacy Graduates Association, KPGA, is proudly here with a prestigious webinar series on overseas career and research opportunities for pharmacy students to direct the younger generation of the pharmacy on the right track. With pride, today we are here for the fifth module and we are going to explore the broad view on Australian pharmacy profession, varied roles of pharmacists and career opportunities, pathways involved, and the study options for overseas graduates. Let me take this opportunity to introduce myself, the fortunate master of ceremony of this webinar series. I am Sonu Benny, PhD Research Scholar, Amrita School of Pharmacy, Amrita Vishwavidyapida. With immense pleasure, on behalf of Kerala Pharmacy Graduates Association, I would like to invite all of you to this gracious occasion of the fifth module of the webinar series and hearty welcome one and all. Let's begin with a prayer song to seek blessings from the God Almighty. Let's begin with a warm welcome address. For that, I would like to invite a young, vibrant pharma regulator, Dr. Mahalakshmi R., Drugs Inspector, Office of the Assistant Drugs Controller, Thrissur, to welcome the gathering. Over to you, ma'am.
Thank you, Sonu. Hello and welcome to the fifth webinar on overseas career and research opportunities for pharmacy students by Kerala Pharmacy Graduate Association. It gives me immense pleasure to extend a very warm welcome to all of you present here on behalf of the entire Kerala Pharmacy Graduate Association. We have gathered here to discuss the scope of overseas career and research opportunities for the future pharmacists, that is our students. The topic is extremely essential in this rapidly changing world, which is filled with multiple opportunities for the youth. Today's webinar is one among the series which focuses on the career opportunities in Australia. First and foremost, I would like to welcome our dynamic president of KPGA, Dr. P.K. Srikumar sir, for his esteemed presence on this occasion. It's my pleasure to welcome Mr. Abdul Nasir, the secretary of KPGA, who is an active member of KPGA and other pharma-related associations. I warmly welcome Dr. Padmaja V, former KPGA president and an active member of Indian Pharmacy Graduate Association Women Forum, who is chairing today's session. I further welcome Dr. Bobby Johnson, Professor, St. Joseph College of Pharmacy, who will be introducing today's module. We are proud to have Mr. Deepu Prabhagar, pharmacist in Australia, as our speaker, who is with us today to share his knowledge and expertise to enhance our mental horizon. Welcome, sir. I would also like to welcome Mr. KP Muhammad Hanifa, Principal, Maulana College of Pharmacy, for being the moderator for today's session. I also welcome Ms. Sauparnika Teresa Sabu, Assistant Professor, Eduthajan College of Pharmacy, to be a part of this webinar. And special welcome to all the guests, the future pharmacists, and all KPGA members for their active participation. I would like to conclude my speech by encouraging the future pharmacists to participate with an increasing number in all the upcoming activities and discussions for coming webinar also. I wish everyone a successful, safe and stunning webinar. I expect that the seminar will be productive and the next few hours will be enjoyable and fruitful to you all. Thank you.
Thank you so much, ma'am, for your loving words. I feel much privileged to welcome a very respected, magnificent, and senior pharma academician, Dr. Padmaja V, immediate past president, Kerala Pharmacy Graduates Association, to chair the session.
Good evening, respected dignitaries, dear members and students. This evening, we are having a very informative webinar for students who wish to pursue their higher studies and also those who wish to work abroad. We have a very young and energetic and experienced faculty, Mr. Deepu Prabhakaran. He is an alumnus of College of Pharmaceutical Sciences for his MPharm. Even when he was doing his PG, he was very interested in publishing papers, and we have published a review article on cardiac biomarkers. He has a lot of experience as pharmacist in Australia, and I hope this webinar will be useful to the students. Thank you all. Thank you.
Let's thank our most beloved Padmaja Madam even in her absence. Today, as we are here for the 5th module of the webinar series, with proud, I would like to invite a streamlined and highly efficient pharma professor, Dr. Bobby Jones D, Professor, St. Joseph's College of Pharmacy, Chartala, to introduce the module. Over to you, sir.
Good evening to all. Am I audible, Sonu?
Yes.
Yes, sir, you're audible, sir.
Good evening to all. Respected President of KPGA, Dr. P.K. Srikumar, Honorable Secretary and my dear friend, Mr. Abdul Nasir P.U., Vice President, Mr. Abdul Samad, Dr. Kaladi, Joint Secretary, Dr. Nishit, today's esteemed speaker, Mr. Deepu Prabhakar from Australia, Dr. Satish Kumar CS, and to all other office bearers of KPGA, immediate past President of KPGA, most respected Dr. Padmaja V, who is chairing today's session. My dear friend, Dr. Muhammad Hanifa, Principal, Maulana College of Pharmacy, Perintalmanda, who is the moderator of today's session. Dr. Mahalakshmi R, Drug Inspector, Thrissur, Kerala. Ms. Saupanniga Teresa Sabu, Assistant Professor, Education College of Pharmacy, Trivandrum. Today's MC, Ms. Sonu Benny. Other respected members and dear students who are the stars of this evening. At the outset, I would like to congratulate KPGA office bearers for organizing such a webinar series, which I think is the need of the hour for our professional graduates. This is the 5th one, titled Broad View on Australian Pharmacy Profession, Varied Roles of Pharmacists and Career Opportunities, Pathway Involved and Study Options for Overseas Graduates. As a faculty of pharmacy, I can affirm that nowadays, most of the pharmacy students are aspiring to go abroad for job and higher studies and settlement. Many of them prefer Australia along with other countries like Canada, New Zealand, UK, US, etc. But they lack proper guidance at many times in the right direction. I'm very sure that Mr. Deepu Prabhakar can throw light and direct them in the right path in their journey to Australian continent. His experience as a registered pharmacist in Australia, entrepreneurship and training students of pharmacy for their qualifying exam will surely be an asset to our students as they embark on their global journey. Thank you very much, sir, for joining us this evening, and I wish all participants a fruitful session today evening. Thank you very much.
Thank you so much, sir. We are so blessed today with an excellent professional, Mr. Deepu Prabhakar, Pharmacist, Australia, to present his valuable suggestions and views on the topic, Broad View on Australian Pharmacy Profession, Varied Roles of Pharmacists and Career Opportunities, Pathways Involved and Study Options for Overseas Graduates. Before moving to the session, I'm kindly reminding all the participants to utilize this platform to clarify all your doubts. At this juncture, let me invite a dedicated and an impulsive pharma professional, Professor Dr. KP Muhammad Hanifa, Principal, Maulana College of Pharmacy, Perindalmanna, to moderate the session and to introduce the speaker. With much respect, over to you, sir. Muhammad Hanifa, sir, please, sir.
Hanifa sir, please unmute. Hanifa sir,
Nishi sir, I think unmute option is not enabled, I think. Please check.
please pause now.
No idea, please check.
Hanifa sir,
Sorry, second. No. Nishta ഒന്ന് unmute ചെയ്യ്. നിഷ്ട ഒന്ന് സാറെ co-host ആക്കിയില്ലേ ഹനീഫെ? നിഷ്ട
sir,
unmute
please,
unmute
sir, please wait.
Hello, am I audible?
Now it's audible, sir.
Yeah. Sorry for that technical error. A warm good evening to one and all. Respected dignitaries, office bearers of KPGA, and my dear students. With immense pleasure, let me introduce today's speaker, Mr. Deepu Prabhakar, who is a managing pharmacist and owner, Melbourne, Australia. He completed his MPharm in pharmacology from College of Pharmaceutical Sciences, Trivandrum, and then worked in drug testing laboratory, Trivandrum, before moving to Australia in 2007. He started his career as pharmacist in Australia after passing all entry exams in 2008 and was working as a registered pharmacist in Melbourne for the past 14 years. During the initial years, mostly the attention was focused to enrich the clinical knowledge and to practice as pharmacists, acquiring skills to confidentially practice in delivering professional services. After a few years of service, interest was then diverted to acquiring business skills to manage a pharmacy and subsequently to fulfill the dream of owning a pharmacy in near future. After recognizing that business skills are completely different to clinical skills and the pathway to own a pharmacy is to develop good interpersonal skills, money management skills, people management skills, etc. Decided to select a pharmacy where these skills could be achieved through the help of a senior mentor and was lucky to get such a benefit from an experienced pharmacist in Melbourne. Studied business management course from Victoria University and gained extra benefit to learn various aspects of business management. Currently, he owns 3 pharmacies in Melbourne and in partnership in South Australia focusing on expanding the business further. He has got 14 years of experience as pharmacist and expanding career towards business point of view in owning pharmacies and learning new opportunities in expanding the business. He is also involved in training new pharmacy graduates as preceptor during their internship year and managed to devise a good preceptor program in our pharmacies whereby business skills are also taught to the new graduates apart from the normal clinical knowledge. So with this brief introduction, let me introduce Deepu Prabhakar. Over to you, sir.
Hi, I hope everybody can hear me. First of all, I thank KPGA for giving me an opportunity to come and talk to this webinar. And I thank Dr. Nishit particularly to come to me and ask about conducting this webinar. And I'm very pleased to come here and give a brief talk about, I would say it's a brief talk about and just a discussion of commonly asked questions rather than a big webinar. So yeah, so let's carry on and move forward. If you can't hear me, please let me know at any stage.
You're audible.
Okay, thank you for that. So yeah, so as I said, the aim of this webinar is to give a brief outline for those who have who don't have any idea about the pharmacy profession or how to come here or what are the exams and the visa part and etc. And for those who don't have to come here, like for retired staff or who are settled in India, I wish to give some brief idea of how the pharmacy profession is carried on or how it works out here, especially in view of community pharmacy. So what are the regulatory boards and what are the job or the roles of a community pharmacist? And yeah, so we can discuss in these two different aspects. One for the students or the passed out pharmacists who want to come here, and others who just want to know how the pharmacy profession works. So these are the points, as you see in the slide. We'll be going through one by one in a brief, short way. But I will tell you that each and every point is very, very elaborate. So we can't bring everything to here, but we'll have a small discussion in this aspect. So yeah, I think it's already been explained.
The slides are not audible. I mean, it's we cannot see the slides.
I see.
Yeah, you can share it.
Can you see now? No.
No. Yeah, now it is visible.
Is it visible now?
Yeah.
Okay. So yeah. So as I said.
Okay.
Thank you. So as I said, we can discuss about these topics, like how the pharmacy profession operates in Australia, especially in community pharmacy, and different regulatory boards and different roles of a pharmacist, and the career improvement, other options after you became a pharmacist here, and outside the community pharmacy, what are the opportunities, and in overseas pharmacist point of view, what are the pathways involved, and especially the visa options. That's more tricky. And yeah, to come to the first point, let's discuss about the TGA. The TGA, it's like an FDA in US. So it controls all the medications here in Australia. So to sell a medication in Australia, either it has to be registered with TGA or listed. There are two types, registered and listed. So basically, it's all the prescription medications to be registered under ARTG, Australian Register of Therapeutic Goods. There is a different type of application, and it's a lot of application process. And even in fact, we are getting more medications now from Cipla, Ranbaxy, even Dr. Reddy's. So there's a lot of medications coming from India. So they do have that TGA application been done, and the sponsoring company has to submit the application to TGA, and once it's approved, the medication can be imported. Unless otherwise, nobody can import the medication. It's illegal, and there are a lot of hefty fines and penalties involved if the medication is imported without the license. It can be done, as I said here, with exceptions for personal use and for experimental purpose, not for any other use. So basically, TGA controls the medication here, and there's a lot of rules and regulations one has to follow. Even not only medication, even with vaccines, sunscreens, vitamins, or even medical devices, everything controlled by TGA. And just to come, just in case of the prescription medications here, it has to be registered. When I say registered, there is a separate process. And the lower risk medication should be listed. When I say listed, the efficacy cannot be studied. When I say efficacy means, like, let's say some natural products, you can't assess the efficacy, whether it's going to give you the therapeutic outcome or not. So in that way, it has to be listed. So it's not completely out from the TGA. It has to be listed or registered. Then you can sell medication in Australia. So coming to the regulatory bodies, APRA, the well-known APRA, Australian Health Practitioner Regulation Agency. This controls this regulatory standard or registration standard for all the professions, not only for pharmacists, doctors, any health professional. APRA controls the registration standard. And when it comes to the pharmacy, that is the APC, Australian Pharmacy Council. It's an independent body, mostly focused on pharmacy education and training. It's not only for overseas pharmacies, it's also for the local graduates. They devise new training, what the internship has to, how it should be, or what courses to be added, or what is to be removed, etc. So it is done by the Australian Pharmacy Council. And since it's based on the education, it's the overseas pharmacist has to first interact with the APC. So because APC involved in the international skill assessment and see thousands of examinations like CAPS exam. It's overseen by APC. So these are the two main regulatory bodies governing the pharmacy. And then this is the centralized one, and each state, there are about each state like Victoria, Queensland, or Tasmania, each state has got their own pharmacy board, like we have in India. So there is a mandatory internship. Those who come to Australia, there is a compulsory mandatory internship. Even though they got like 20, 30 years of experience in Gulf or anywhere in the country. Because the thing is that there are a lot of rules here, and the patients or the customers can go and complain easily about any pharmacist, and they will be involved in a lot of issues. So to prevent that, the pharmacy profession is devised in such a way that there shouldn't be any errors or any issues after one has become a pharmacist and practice in a more safe way. So when I say pharmacist, it's not like you have a good clinical knowledge and dispense medication and talk about a medication with everything like pharmacology, pharmaceutics, pharmacokinetics. It's not like they're not expecting that. That's only one of the several requirements. They're not expecting a very highly intelligent pharmacist here. There are a lot of other requirements. They're mostly, even an owner if an owner want to employ a pharmacist, they look for other skills, not only the clinical knowledge. Especially this one is listed: attention to detail, good management skills, strong communication skills. So it will gradually develop. Once you come to Australia, even everybody will struggle. Even I was struggling. Like you can't understand the fluent, like their accent. The fluence will be there, but you can't understand the accent. But it's all only for a short period. Once you get used to that accent and everything, then it's like just an easy thing. So sometimes you have to work independently, then you are liable, like, because the registration is to hold the liability. So you are liable for anything happening. Sometimes you have to work alone. So you need to have that experience and skill. How do you tackle the situation? And of course, build rapport with other professionals. It's all this common personality or skills needed to become a good pharmacist. So there is a lot of questions asked through email. So that's why I just put it this slide like this. So can I try other career opportunities other than community pharmacy? But majority of the entry opportunity is in the community pharmacy because of the visa options. When I say visa option, we can come to the later, but CAPS exam is one of the biggest entry pathway for overseas graduates. There are other entry pathways without CAPS, not for the pharmacists, but other like industrial pharmacist, or I think only the industrial pharmacists, we don't need CAPS, but other than that, CAPS is the only pathway for a pharmacist, overseas pharmacist to come to Australia, a bit more easier than any other way. But CAPS and visa are both entirely different. So passing the entry exam and visa are two different entities. So getting one or the other doesn't guarantee the other one. So you have to work out a plan. It's not very easy or it's not very hard, but you have to work out a plan how you're going to achieve that. Once you go and sit and study CAPS exam and pass everything, then you're stuck. Then you don't know how to get the visa, how do you contact a owner or employer for the job. You just don't know. Some may get it through some agencies or someone, but most of them get stuck. So you need to have a plan before you enter into this process, because it's not time consuming as well. It's also, you need more money to spend each and every step. So that's the basic, I'm just talking about the basic aspects of overseas pharmacist view and how to come here. Then when we go into the different roles of pharmacists, so it's not only a community pharmacy, there is a lot of different pharmacy sector. But once you come to Australia, you come as a community pharmacist mainly. Then you can divert your career, like to go into hospital or industry even, or you can get more. These are the specializations like diabetic educator or medication review. These all, once you became a pharmacist, you can get do extra course and gain some specialties and become a specialty pharmacist. So when you come to the community pharmacy or community pharmacist, there is a lot of different positions available, like manager or pharmacy assistant is not a pharmacist, sorry, and pharmacy manager or owner or professional service pharmacist, residential care pharmacist. There are different type of roles. You can see most of the advertisements, they advertise as different types of roles within the community pharmacy. So it's not like you go and dispense and that's community pharmacy. So just a basic outline about industrial pharmacies, because so many questions might be asked about this industrial pharmacies. Yes, it is included in the visa option, but you don't need to be a pharmacist to work as an industrial pharmacy here. So you can study any course, even Bachelor of Science or Biotechnology or any other science-related course or even non-science related course and get an entry into the industry. So it's very highly competitive, in other words. So there are opportunities. I know few people have come through this way, but with very little. Like I don't know much about this opportunities, but you can have a look if there are any industrial pharmacists listening. But you can have a look about these options, these visa options. As I given the slide, you can have a slide go through later on. But this is most competitive because you need to find a job. That's an issue. And again, there's a lot of questions again with clinical trial job. The clinical trial jobs are there, but same thing, also competitive. And the main question is how to get the visa. So I don't know whether you can get a visa for an overseas graduate to come here as a clinical trial pharmacist. I don't know as of now, but there may be an option. You have to go into and dig deeper. But for those who don't need a visa, like whether they got PR or something like that, still it is possible. But you have to wait for a little bit of time because entry is not very easy, like in the community pharmacy. The community pharmacy jobs are very, very plenty, and you can basically each and every suburb has got community pharmacies. So you can spread around. But in clinical trial, it's not like that. You need to have some experience, or even they ask for the local experience. But most of the jobs are advertised, those who are available locally. So it's not like overseas graduates can come here and take the job. It is not impossible, but very hard. So this is one of the advertised position that I saw in the advertisement in the SEEK. They advertised for CRA position for clinical trial. These two are the requirements, and any degree or equivalent qualification or like nurse or pharmacist or doctor, anyone can apply. So it's a competitive environment. So you need to compete with other ones, those who are already here. And there's a lot of people who are already looking for jobs in this sector. So yeah, so these are just basic about the other sectors, but let's have a look about the community pharmacy sector in Australia. So the community pharmacy sector it's very highly regulated. It's not like in any other countries. So maybe in New Zealand, yes, only a pharmacist can own a pharmacy. In most of the countries, anybody can own a pharmacy, but only a pharmacist can work. Here, only a pharmacist can own. Nobody can own a pharmacy. And that too, there are a lot of restrictions. Like say, for example, in Victoria, if one pharmacist can own only 5 pharmacies, not more than that. Because the government put restrictions to avoid this intention of getting more money just by doing this business. So there are a lot of restrictions from the government. And it's, when I say highly regulated, means like nobody can just go and start a pharmacy. There are location rules. Like if there is a pharmacy in one place, there are, if somebody wants to set up another pharmacy, there should be like a distance requirements, or there's a lot of requirements. You can't just start a pharmacy and you won't get a license. So it's a very highly restricted business. And so there is a value in owning a business. That's what I was coming to it. So if you own a pharmacy business, it's more value in it. And it has got its own disadvantages as well, but it's more value in it. And it's an opportunity for an individual pharmacist, even for an overseas pharmacist, to group together and own their own pharmacy after some years of experience. And it's completely different from clinical aspect. So a very good pharmacist, a clinical pharmacist, need not be a good owner. So one has to learn so many things here and divert, if they're interested, then divert their attention to business. And there is an opportunity to own a pharmacy in Australia. So the main thing in Australia is the PBS system, like Pharmaceutical Benefit Scheme. It's a system where the medications are funded or subsidized by the government, like mostly life-saving drugs, like let's say or maybe 100 to 200 drugs are subsidized. When I say subsidized, means like given an example here, like if they say, let's say for the cost of the medication is $500, and if it is listed under the scheme, then the patients pay $41 or $46. I think it's old news, and $6.50 if they earn less or like low income earners. So they pay only this cutoff, and the remaining $400 and something will be paid by the government to the pharmacy. So this is the subsidized system. So because of this system, it is highly controlled. Like the government put a lot of rules and restrictions, and even the rebates. It's all set up. So so this system actually benefits all the Australian residents, so that they can afford to pay the medications and get these medications without any issues. So this is one of the best system, which is still going in Australia. Yeah, so just again to the community pharmacy. It's very highly respectable profession in Australia, and it's very highly paid in part to the other professionals as well. When you start, the wages may be low. So you might hear a lot of news coming out saying that the pharmacist wages are low. But in anywhere it's like that. When you start, the wages will be less. But as you grow on, and when you bring the value to the business, then the owners or the group or the managers will be happy to pay you whatever you want. Like when I say whatever you want, means on par to the professional aspect. So the pharmacist job, as I said, is not like just to expect. They are not expected to just dispense and counsel the medication. That is what's most prominently displayed. But in a typical day-to-day pharmacy, you can see like people just come and walk and they said they want to talk to the pharmacist for advice. Sometimes they ring the pharmacist and ask the questions what to do and what not to do, or they will ask you whether the prescribed medication is suitable which is prescribed by the doctor, because sometimes they trust you more. They'll ask you whether this medication is good or it is opt to their condition, or sometimes even pharmacists can reject dispensing the medication. Even when I say reject, there are professional obligations from a pharmacist's point of view. If the pharmacist feel it is unsafe to the patient, they should not dispense. Let's say if you get a prescription of, okay, the doctor wrote the prescription, let me dispense it, and the patient ended up in a hospital because of that, because of the high dose the doctor wrote, and the pharmacist and the doctor are liable for prosecution. So the pharmacist's job is to find, identify, and rectify the issue, whatever comes in his day-to-day pharmacist job. So so that's why it's more like attention to detail is very essential. Like a lot of things can go wrong. So one has to go through each and every step, and it's not a very hard task. But as you get on used to it, it'll become very normal thing for any pharmacist. So the people can come to the pharmacy at any time. Sometimes they think the community pharmacy is the first point of contact. They will come and ask you whether they have to see the doctor or they can get something from the pharmacy. So it's like a very good profession where you can help this community as well, and you get some professional satisfaction. All right, coming to the schedules, like in India, we got like a lot of schedules like Schedule H or there's a lot of schedules I forget. But in Australia, when it comes to the schedules, in a pharmacy point of view, there are 4 main schedules. There is one more schedule, Schedule 11, but let us concentrate on 4 different schedules, 2, 3, 4, 8, and unscheduled. Unscheduled means where you can sell in supermarket. When for example, Panadol or paracetamol can be sold in supermarket, which is less than 24 tablets. If it is more than 24, only in pharmacies. You can't sell it in a supermarket. So that comes under unscheduled. So Schedule 2 means it's like over the counter, like front shop. Just you can go and the customers can go and pick it up by themselves. They don't have to ask or wait for someone. Schedule 3 is pharmacist only. You don't need a prescription, but you need the pharmacist's intervention to decide whether the particular medication, the particular requested medication is suitable for the patient or not. So they can reject if not. Salbutamol inhaler, for example, is one of the example, and low dose corticosteroid cream. All this comes under Schedule 3. Schedule 4 is prescription only. Schedule 8 is like control medications like morphine, oxycodone. So these are the main 4 different types of medications classified in Australia. So yeah, this is I just show you where the different schedule of medications are kept. This is for the basic understanding. So this is a typical pharmacy environment. You can see here most of the pharmacies should have a shop front. They won't give you the license without a shop front. So there should be a shop front like here, like this is a shop front. There should be all the Schedule 2 medications are displayed here or anywhere here. Schedule 2, Schedule 3 here behind the counter. The patients or customers can't go and collect by themselves. That's our schedule 3. And schedule 4 is here inside. And schedule 8 obviously locked somewhere in the cupboard, in the safe. So these are the these are the 3 type of medications you can visible in any pharmacy. So you can't keep the schedule 3 here or schedule 4 here. So it has to be in the same spot. So so basically when the customers come, if it is schedule 2 as well, if they have a doubt, they will speak to the pharmacist, and the pharmacist will just talk to them and identify the issues and sort out the issues by opting one of the schedule 2 medications. So it's not like completely they will go and collect S2s as well. There's a different types of pharmacies, like big pharmacies, shopping center pharmacies, small ones, medical center. So the size is different, but all the requirements I told is the same. So the shop front, when I say shop front, you can see this is the main shop front. And in the shop front, there are a lot of things are sold. So the shop front is divided into 2 sections. One is the general merchandise, like you can sell, like for example, soap. But when it comes to the professional service area, like near to the dispensary area, it's called professional service area, where the S2 medications are sold, like for the skin or for the digestive system or for the painkillers. So these are, let's say this is for the pain. You can see the Nurofen or these kind of medications are displayed, and the stomach. So this has to be displayed near to this prescription area, and obviously the customers can speak to the pharmacist or the pharmacy assistant, wherever, to select one of the medications. So yeah, so it's coming to the community pharmacy services. What are the services offered other than the dispensing? So there's a lot of, depending upon the size of the pharmacy and the turnover and their customer turnover, each pharmacy has got their own services. So like, for example, sleep apnea or weight management, or like health check or blood pressure check, cholesterol check, whatever, a lot of services. And the most common one now becoming is vaccination. So there are 3 vaccinations. The 3 vaccines are allowed by the government to give without a script. And now it's COVID vaccine. So the pharmacists are very highly involved in vaccinating patients when there was a COVID outbreak. So 80 to 90% of the people are vaccinated through the pharmacies. It's one of the COVID vaccination clinic. There should be a separate consultation room, and the pharmacist can inject. They can do, once you became a pharmacist, they can do 1-day course and become a immunizer pharmacist. So you can immunize the, it's one of the service that pharmacists can gain once you became a registered pharmacist. And the other services, as I said, it's all done in the consultation room, not in open public. The blood pressure check, or even the compounding pharmacy service. Yes, some of the pharmacies has got the compounding pharmacy service. Like let's say if the particular medication is not available commercially, some of the medications it's not available commercially. So in that case, the doctor can prescribe, and the pharmacist can make it in a capsule form or a cream form or whatever. So there is a special license involved and a special course. It's not a big course, like maybe 1-week course. And then you become a compounding pharmacist. You can make capsules or creams or anything inside the community pharmacy, and only to be sold to the particular patient with a particular prescription. So there is no TGA license involved. And if you want to sell it for the public, then it's became a different thing. There's a different license. So yeah, these are the extra services offered. I'm just showing as an example. This is a COPD screening where the customer blowing into the spirometry device, and the pharmacist is performing the COPD screening. And the weight loss program, there's a lot of weight loss program, approved weight loss program by the the government, and it's all done through the consultation and the diabetic check. So the pharmacist can become a diabetic educator. Once they become a pharmacist, they can do additional 6 months or 1 year course and become a diabetic educator. And it's a specialization where you can advise about any diabetic issues. So yeah, this is the 3 vaccines are allowed in Australia without a script, like flu, MMR, and whooping cough. So they can provide vaccination, as you've seen earlier. So there is an extended pathway for the pharmacist prescribing. It's not yet it's not yet completely done, but there is a trial going on in Queensland about prescribing and dispensing about these medications, trimethoprim, nitrofurantoin, and ceflexin without a script. So the trial is still going on. So thereby the government can reduce the extra burden onto the doctors, like people are just queuing up for like small issues. So once this trial is completed, and if it is successful, then the pharmacist can prescribe some of the medications like listed this. So we believe that it's a starting point for a pharmacist to prescribe some of the medication as well, and dispense. So there is a new developments. When you say new, it's maybe an year. So the e-script. So now there is a transition from paper prescription to the QR code. Like the doctors can generate a QR code and send to the mobile, and the customers can come to the pharmacy with the QR code, and they can scan it, and it is just decoded and just became a normal script. So there is no paper involved, and any repeats, the doctor can write a repeats here. In Australia, there is a repeat thing. Like, for example, if the doctor prescribe a medication, the doctors can write with a repeat or without a repeat. Without a repeat means you can't get again. So you need to see the doctor again and get a prescription. Sometimes the doctor write, let's say atenolol, 50 milligrams, 1 packet with 5 repeats. That means you can get 5 times. So each time they can come to the pharmacy and get it done, and it becomes 4, 3, 2, and 0. Once it becomes 0, they have to see the doctor. Normally it comes with 5 repeats, most of the medication. So once you scan this one, the repeats are again sent back to the mobile, and they can again come back with the code. So this transition is being going on for the last 1 year. So it's been interesting, and it's slowly progressing to the next stage, which we are expecting, like they can send the QR code directly to the pharmacy and get it delivered. So once it is dispensed, the pharmacist has to, I think first I have to go to this one. So dispensing procedure. Pharmacist here, the main job is actually dispensing. There is no doubt about it. Pharmacist has to dispense medication and check the previous history, any interactions, or call if there are any doubts. When I say dispense medication and check history, let's say if the patient is coming with you dispense like metoprolol 100 milligrams this month, and they're coming again with a script for 50 milligrams next month, you can't just go and dispense 50 because you have dispensed 100. So you need to check with them whether they're taking the 100 milligrams, or the doctor asks them to reduce it to 50. If they don't know, you have to call the doctor and assess. So it's not your job. Like, it's not nothing like that, because you're responsible for everything. So you need to check the history, whether everything is correct, any interactions, or call doctor, and then print the label. There is a label printer. Then it's a mandatory thing that you have to stick the label to any medication, any prescription medication. You can't give it out without a label. And once you stick the medication, you have to double check and scan the medication code to the box. So you have to scan the printed label with the box to avoid the selection error. Sometimes you will dispense 50 milligrams and you will take the 100 milligrams. So these things can be avoided. So so this is the most important aspects of pharmacist. in a pharmacy, and at last then you have to go out and counsel the patient about the medication, and to print out the CMI, like any details about the medication if it is new. So these are the this is an example of how the label is printed on the box or the bottle with the name of the medications, what is the direction, patient name, which pharmacy it is, and any ancillary label. For example, if it is diazepam, then I have to stick the ancillary label 1 to tell them that the medication causes drowsiness. So this is one of the mandatory. Label 1 is mandatory. And once you stick the label, then you scan it whether the dispense medication is correct. So by this way, most of the error can be stopped. The dispensing error can be very much minimized by following this exact procedure. And at last, counseling, that's a very important part. So you counsel the medication. Sometimes once you start counseling, then you can build a rapport with the customers, so that it's one of the highly valued point to bring back the customers back to you. Then these are the new, it's not new, it's been here for a while, like it's an automatic dispensing machine, ROA, where once you dispense the medication through the software and you click enter, this picks up the medication and bring it to the tray near the pharmacist. So the pharmacist can take this and just label it and give it out. So it's a new it's a technology. That's it. So coming to the rural pharmacy. So these are the most important job opportunities where the overseas pharmacists can utilize their options to explore more job opportunities and visa options in the rural pharmacies. Most of the city pharmacies can't take overseas graduates. It's kind of impossible because of the visa options. There are 3 different types of visa. We can talk about it later. But mostly for the overseas pharmacies, the rural pharmacies are the main entry point. When I say rural pharmacies, like it should be a distance from the city. Like let's say in Sydney, you can't go and work. But if you go from like 300 kilometers from Sydney, it became a rural pharmacy. So that's where the opportunities lie. So the overseas pharmacists who want to come to Australia should look into the rural pharmacies and try to have a contact with them. There is a different ways of contact, which we can discuss later, but these are the entry points for any overseas graduates. So just apart from community pharmacist, it's a hospital pharmacist. It's one of the it's a very good position to become a community or a hospital pharmacist as well. But the entry is a bit hard for a overseas graduate, but not impossible. Most of them come here as a retail or community pharmacist. They work here for some time. They study some PG diploma or master's course here. Then they apply to the hospitals and get into the hospital, because some people want complete clinical. That's only hospital or pharmacy can offer you. When it comes to the community pharmacy, there is a involvement of business aspects. You can't completely avoid those. So some like to go into the hospital, and they like to do all this medication chart reviews and able to calculation of dosages and TPN, those kind of aspects. So that's a different career thing. So for that, I'm not saying it's impossible, but local graduates usually prefer to go into the hospital pharmacy. So there are only few options left for the overseas graduates. If you're looking for the hospital pharmacist, there are few who already got into the hospital pharmacy that I know a few years back. It's not impossible, but always community pharmacy is the entry point. And then you can switch over to the hospital pharmacist. If you're thinking about hospital pharmacy, that's what my point of view. So once you became an hospital pharmacist, again, there are a lot of specialties inside the hospital pharmacies, like oncology pharmacist, nuclear pharmacist, critical care pharmacist, clinical trial pharmacist, antibiotic. So there's a lot of pharmacists in different specialties inside the pharmacy, inside the hospital pharmacy. Yes, there are some regulatory jobs here, but it's not very like, I don't know, the graduates are not, local graduates are not very highly behind these regulatory affair jobs, like pharmacy board inspector or drugs and poisons officer, TGA officer. It's a possibility. Those who are interested in regulatory affairs, there are chances once you became a pharmacist, gain experience. Possibly if you gain experience in let's say in hospital, community, and industry, there are more chances you will get into this. So it's only the interview. There's no exams or nothing, and there are regulatory affair jobs available. Yes, coming to the CAPS exam. So for the overseas pharmacist, there are 3 different types of pathway. For the common pathway is CAPS pathway, and for some of the countries like Canada, Ireland, UK, US, it's a COAP, competency stream pathway. And for those who want to study here, like pharmacy, like B.Pharm or M.Pharm, it's a completely different pathway called International Student Stream Pathway. So there's 3 different pathways. One can come to Australia as a pharmacist to become a registered pharmacist. CAPS pathway is the most one of the very, very common pathway all the graduates will prefer. So that's why I'm looking into the CAPS pathway. This is just, I'm just quickly going through the slides. You can come back to the slides, and I think most of the people might have known about this pathway. So just quickly go through this pathway. This pathway is done by the Pharmacy Council of Australia, like pharmacycouncil.org.au. First step is you have to assess your skills, like you have to send all your B.Pharm, all these degree certificates, etc. Then they will assess. Once they say, okay, your pharmacy is equivalent to ours, then you qualify for the CAPS exam pathway. And then you have to study for the CAPS. Then once you study for the CAPS, you pass the CAPS exam. It's conducted all over in India. Most of these states has got the exam centers here. Once you pass the exam, then they will give you the certificate, CAPS passing certificate. So for the eligibility, like when I say this eligibility skills assessment, these are the just basic aspects like identity, academic qualification, registration status, because you need to be a registered pharmacist of your country. So you need to show that the Pharmacy Council registration certificate. Work history is not compulsory, but it's very compulsory for applying visa. So let's say you passed B.Pharm now, it's very hard to come here with a, you can write the CAPS, you can pass the CAPS, but without work experience, you can't apply for a visa, because visa is completely different to the CAPS or pharmacy, anything. Visa is managed by the migration department. Immigration department rules are completely different. It's not related to pharmacy at all. So there you need work history. Again, IELTS or English is not required for writing CAPS, only after you get the professional registration. So I've just included everything. You can quickly come back. I just quickly go through. You can later come back and have a look. Eligibility, register, sit the exam, pass. Once you pass, it's valid for 3 years. So you need to plan accordingly. So there's no stress, but you have to plan accordingly. Whether it's not like just go quickly and write the CAPS exam and quickly finish the 3 years. Again, you have to write the exam. So once you finish the CAPS exam, you need to apply for the provisional registration. That's very compulsory. And for that application process, you need to be physically present in Australia by any visa, but you have to be physically present. Then you can apply for a provisional registration. Without this provisional registration, you can't even apply for anything. So you need to take these factors into consideration and plan accordingly. You need to have a proper plan from A to Z to go through step by step, because it's a time consuming process. It's not like going to finish in 1 year. Most people take 3 to 5 years, starting from the day one, but sometimes it can be done in 2 years. So it depends on your financial status as well. So when it comes to the English 7, overall 7 is needed in all the NPT score 65. This all will change. You have to check the new score in the APRA website. So after the CATS, there's other thing. You have to select suitable visa category. So which visa is possible? So that is most tricky part. It's only the 3 different visas, like 190, 491, or employer sponsored. 190 and 491 is like government sponsored or state sponsored or state nomination. 494, I think it's employer sponsored. Like employer can sponsor you in a particular suburb, in a particular state, not everywhere. Once they get I think the owners can check whether the pharmacies they situated can take one intern from overseas. So once it is done, they can easily apply for the 494 visa, I think. Yeah, I think I have included those numbers later on. So yeah, so here you can see you need to be in Australia to apply for professional registration. So just before writing the CATS and passing the exam, you need to carefully go through this point when you can come to Australia. If you can't come for next 2 years for any reason, don't write it now. Just wait and plan accordingly and write it later and come back after certain years. And again, skill assessment letter's validity is 3 years. And English exam results, which is validity letter 1 year. So there's a lot of validity. So you have to plan accordingly. And again, once you get the provisional registration, it can be renewed only 2 times. So you can't get let's say if you got a provisional registration and you can't find an internship, again, you can register 1 time. Again, you can register 2 times. But 3rd time, you need to do some extra like education things like CPD, called as continuous professional education. You need to do like online and get points, and again you get to reapply. So it's not impossible, but you need to take these factors into consideration. Professional registration is needed to work as an intern pharmacist. The validity is 1 year. So you need to finish this before the validity ends, or otherwise you have to apply for extension. So these are the things which you don't need now, but you can come back and refer later. So this is the next pathway for the UK and other countries apart from India. So it's more easy pathway than the CAPS pathway. And the internship is maybe only for, sometimes it's 4 months, sometimes it's 3 months for UK. But for any other countries, the internship is compulsory 1 year. And coming to the study options are very good in Australia. It's very, as you know, that Australia, like US, it's very highly attracted to the international graduates. Even it's the second most, I think the economy lies in the international graduates from studying by studying in different universities. So I've given some examples here. So this example, University of Sydney offers Master of Pharmacy course. It's a 2-year course which allow graduates to process through registration. You don't need CAPS. Once you go through this course and pass the course, you don't need CAPS. You just it's like studying in India. Like once you study the course, come out, get the internship, and become a pharmacist. But there's a lot of fees involved. There is a range of scholarship, but still it's a big fees. So you can check the university website, how much is the fees, whether it's suitable for you, rather than wasting your time. If you think by studying CAPS and looking for these options, which may not be suitable for everyone, because everybody, if 200 people try for a visa, only maybe 20% will get for this year, say for example. So you need to think about other aspects, whether you can come and study any other course. But there are a few people who take a different pathway. Like it's not a straight pathway. Like they pass the CAPS exam from India and they come here to study some other course, like business management course or health management course. They come here to study the course, which is the lowest fees, and then they go and speak to the owners. They go around and try to get an internship position. That is one of the good way. It's one of a different pathway, so that because pharmacy owners or groups or managers or management like to take a graduate who are already present in Australia. They don't want to take from overseas if somebody is already here. So few people have come, few pharmacists from India come here and study different course, and they then transfer their student visa to the training visa. You can transfer from student visa to training visa. The visa is 407, and once the owner agrees, they can offer you the permanent residency visa. Yeah, this is just a master course. I've given you some example for the bachelor's course. If you want to study bachelor, like those who want to study bachelor, it's one of the sample university, Charles University, and it's around $30,000 per year, and even it's recognized by Singapore Pharmacy Council. So yeah, so this is the only disadvantage is the fees and other expenses you have to meet. So there's a lot of questions he asked by many in the last few years, like, can I work as a pharmacy assistant without CAPS or registration until I pass CAPS? No, you can't work as, there is no assistant pharmacist. There's nothing like that. Either pharmacist or pharmacy assistant. Pharmacy assistant is completely different. It's not like a trainee pharmacist. It's like friend shop. Like you can't come inside the dispensary, but when I say you can't come, you can't touch medications. Like you are just outside the pharmacist area, or you're not allowed to dispense, or you're not allowed to do anything. So there is a pharmacy assistant. So you can't work as a pharmacy assistant if you are intending to become a pharmacist. But you will get experience. You want to work as a pharmacy assistant in the front shop to get experience, that is a different thing. But you can't work and get some training, then you apply for CAPS. So to get an internship to become a pharmacist trainee, you need to have a professional registration. For that, you need to pass CAPS. There's no exceptions. And either you study here or you pass exam. And if somebody, is like there's no registration, or if they work as a pharmacist without registration, the fines are very high, and even they can go to jail. So nobody will be thinking about this. So there's one more question, like I got a lot of experience or PhD or anything. Can I apply to the university for teaching job? Again, the question comes to visa. So what visa are you going to apply? If there is no visa options for you, then it's very hard. But if you already got a PR or visa, yes, you can. And the main thing here is they ask for the PhD in one of the reputed universities. So most people, I think one of my friends studied PhD in Monash, did PhD in Monash University, one of the best university in the world, and get into the teaching profession. It is possible, but you have to be prepared to study PhD. Those who already got PhD, I'm not sure, but normally you have to apply to the university and ask for the options, whether they consider that PhD is valid, whether they can do some teaching. When I say teaching, it's mostly like a research-oriented teaching. Like, for example, Monash University will advertise jobs for a research associate in let's say drug discovery. So they will be looking for graduates who already got PhD for the drug discovery, or they are undergoing PhD. So you need to be a PhD graduate already in Australia to get into this position. Otherwise, it's a bit competitive. So it's very hard, I would say. So when it comes to the visa section, like industrial or hospital pharmacist, these are the classifications, but most of them are irrelevant. 190, 407, 494. First two and last two are the most relevant ones. These two, 190 and 491, are offered by the state government. So it's very highly competitive. Let's say when I say 491 and 190, once you pass the CAPS, if you apply for 491 and 190, you don't need an employer. You just apply to the government and they give you the visa, and you come here and look for a job. That is how the process works. 494 visa means you come with a job. So most people like to go through 494. So, but still 190 and 491 still exist, and people do come here, very highly competitive, and only few positions available, like let's say about 20 or 25 per year in each state. So the most quickest way is 407 visa, and it's a training visa. It's a new visa for 2 years, issued by the employer. So you need to have a contact with the employer and get a trainee visa 407 approved, and the employer has to apply to the immigration department and get it approved. It's not like any employer can give it to you. They have to apply to the migration department and get it done. There's a 2 ways application. Employee has to apply, employer has to apply. Once the 2 applications been done, they will get the 407 visa. But recently, in the present circumstances, 407 and 494 visas are getting more popular because of the high shortage. I don't know why the shortage, but there is a high shortage exists in Australia in the last 1.5 years. So the government is relaxing. When I say relaxing, sometimes 407 visa takes 1 year. So it's not like straight away you will get it. If you apply now, it may take 1 year. But the migration department is relaxing these visas. So it is possible for those who already passed CAPS exam, it is possible to contact those owners who are in the regional or rural locations and get connection with them through any ways, through by agencies, or you can ring them, or you can contact. If it is a group, it's better to contact a group. You can contact the HR and speak to them. You have to follow it up. You have to initiate a lot of things, but it's possible to get the 407 visa. Skilled, that is the training visa issued by the employer. When it comes to 190, it's through the expression of interest through the migration website. If you can go directly to the migration website and click EOI and click all your details, upload your details and CAPS exam, and forget it. So then the government will invite you whenever they need it. So that is 190 visa. So mostly it is for IT professionals, doctors, nurses. That's very popular among those health professionals and IT professionals. But pharmacists can come, but very low numbers. When it comes to the 491, state migration, particular state, let's say Tasmania has got 491 visa, and they can, so they have to live there for at least 3 to 5 years. They can't move to other state. So it's like a skilled migration regional visa for that state only. So these 3 visas are important visa. So you have to explore this visa before writing even CAPS. You need to find out how you're going to do this, whether you got any options to come here. If you don't get this visa, because you're spending maybe around 5 to 10 lakhs for all these expenses, and ending up wasting your time. So you have to have a proper pathway or guidance as well to go step by step. As I said, 491 visa is getting very popular in the recent years because of the huge shortage. I'm not sure how long it will last, but this is the best time to seek. If you are looking to come to Australia, it's 494 visa is the best option, because so many employers are looking for overseas graduates. I'm talking about rural location, not in the cities. So many rural pharmacies are looking for pharmacists, because no local graduates go to the rural areas. So there's a high chance now to get the 494 visa, but you have to connect to them properly. You can. I just added this one. You can come back and have a look later on, like different states, like Victoria. This is Canberra. How the skills or different overseas applicants are classified, and what is the critical list, and what are the requirements. South Australia is no 491. It's only 491 visa is applicable. What are the points? So just added for your information. After the seminar, you can come back and have a look. So it's 494 visa is available anywhere. But it's all based on the postcode. Like here, we got PIN code in India, same thing. So the migration department, you have to tell the migration department this is the PIN code. They will have some calculations based on the PIN code. Then they will give you the opportunity to take an overseas graduate. I'm talking about the employer point of view. Employer has to contact the migration department and get it approved. Then they can take overseas graduates. For example, Northern Territory has suspended the 190 and 491 visa. So 494 is available anywhere in rural areas. So best option is, as of current year, demand is high rocketed. So you have to dig it and explore. Nobody is going to give it to you in your hand. You have to go and seek or even explore the pathway how we are going to do it. Because there are many want to come here, but the opportunities are limited because the pharmacies, when I say the opportunities are limited, the community pharmacies in Australia are regulated. It's not expanding day by day. Let's say if there are 5,000 pharmacies, it may go from 5,000 to 6,000 in 5 years because of the regulation. So the numbers are only slightly increasing, but why there is a huge demand means the local graduates, it's here, it's not like in India. Here, even pharmacists aged like 50 years or 45 years, they change their career easily. They go and study accounting or they seek IT. They change everything at any age. So people who get bored after, like say after 50 years, they will go and study IT. So that's why there is a little bit of opportunities suddenly came in the last 1 year, and you can utilize that, especially for 407 visa by contacting some of the employers or agencies. There are a lot of agencies if you look at in Google, and you can contact them, and you can even contact the employer by, you can look into the Seek website. Seek, SEEK. Seek is one of the job seekers website, and you can find the employer details. You will get the HR details. You can send an email here, the email, and when you send an email to anyone here, they will respond to you, whether it's no or yes, but they will respond to you. So you can send an email, or if your finances are good, you can come to Australia by any other visa, study some health management course after passing CAPS. That is the best way. You can come here and meet the owners and have a good connection, make an interpersonal skills, and you can easily do it. So yeah, just want to give you some basic tips about your curriculum or resume writing, because you should not include any of the private information, like whether married or male or female, especially male or female. That's not allowed here. So don't include those kind of information in the CV, and make it 2 pages, because nobody is going to look at your CV more than 5 minutes. So make it 2 pages and 1 covering letter. That's more important. And list all your sales related job, especially if, let's say, if you worked in a shop, in a retail shop, that's more regarded than if you say that you are a director of a research company. So because the owners will say, oh, you got good customer experience, tackling the issues with the customer. It's all related to community pharmacy, all right? So hospital pharmacy is different. So that is a different thing, but I'm talking about in the community pharmacy perspective. So, and also in Australia, you don't need any other high qualification. You don't need an M.Pharm. You don't need a PhD to go into the CAPS pathway and become a pharmacist. You just need a B.Pharm and write the exam, and CAPS passed, get these pathways done, then you became a community pharmacist. And you can even call the owners. But if you are receiving a phone call, let's say if you're an HR manager or somebody is saying that I'm going to call you tomorrow, that means that they are testing your communication skills. It's not because they want to do an interview. They are testing your communication skills. So let's, if you are starting a conversation, always start with a wish, like how are you? Start with a conversation, and speak very slowly and clearly. There's no need to rush. And they're just assessing how well you can communicate with the customers and how well you are talk and make decisions, etc. etc. So the owners or managers or the employees will be looking for good communication skill person rather than a very intelligent person. Yep, so I think I have reached to the point where I have given you a brief idea of, I think, all aspects of the pharmacy, plus the rules and regulations, plus the pathways involved. So I'd better conclude this seminar or webinar. It's already here, it's 2 a.m. Thank you.
Thank you, Mr. Deepu. Thank you for enlightening us with the overseas career research opportunities for pharmacy students. Hope you have all enjoyed the session. He has elaborated regarding the entry steps to CAPS exam, different roles of pharmacists in Australia. There is industrial pharmacist sector, clinical trial jobs, then community pharmacy sector, then pharmaceutical benefit scheme also provided by the government of Australia. Then classification of drugs into schedules and community pharmacy services. Then rural pharmacy, which is the entry point for many of the overseas aspirants. Then regarding the hospital pharmacist profile also, he has explained, and the CAPS pathway. And also the study options in Australia, and also the general visa details. I think it was a complete package. So any questions? I think we have few questions in the chat box. So I'll just read it out. Please let me know more about APRA, how it's functioning in controlling all the health sectors.
Okay, yeah, APRA is the sure. APRA is the Australian Health Practitioner Regulation Authority. So it devises all the registration standards for each profession. So they got a reference standard for overseas pharmacists, for local graduates. So it functions the registration standards. Like when I say registration standards, what you have to study, like to become a doctor or pharmacist, or how many years of experience, or what is the English standard or professional practice standard. They prepare the standard. So their main job is to prepare the standard to get into the registration for each and every health professional, not only pharmacists. It's from, when you go into APRA website, it is clear what is their main goal is. The goal is just a registration standard.
Okay. Thank you. Next, should we write any exams after we complete our 4 years of B Pharmacy? I think it's posted by a student.
Okay, once you complete the B Pharm as CAPS, there is no other option. CAPS is the only option. Once you complete the CAPS option, when you get into internship, there are exams during the internship. That is different, that everybody will pass. So you don't have to worry about that. So CAPS is the entry. When you go into internship from day one, you'll be having some exams in between, oral exam, like Viva, when you say at the end of the internship, and I think there is a written exam as well, but it's not very tough. Once you get into internship, everybody will pass out at one point because you will get good training. But CAPS is the entry. That exam is compulsory.
Okay. Another question is, I think you have answered it before. Is it possible for an overseas pharmacist to get an internship in Australia after completing CAPS exam and language exam?
It's like looking for a job in India, same thing. So once you complete BPharm in India, same thing applies. So there is no other way. You have to go through contacts, or maybe people call it luck, or people call it as interpersonal skills, whatever, same thing.
Okay. Another question is, can you please outline the salary structure for various pharma professions there, like clinical, industry, research, etc.?
Industry, I'm not very familiar, but when you come to the community pharmacy, there's a high salary in rural areas. Let's say they give you a package. Let's say most of the pharmacists now getting like 100K to 120K in rural areas. When it comes to the city or in metropolitan like Melbourne or Sydney, the salary will be very less, but it's now increasing because of the shortage. If it is 100 in rural, it will be like 80, 90 in city. So it's like per year, 100K or 120K per year, yeah, average salary.
Okay. Another question is, what are the area and storage specifications required for starting a pharmacy in Australia? How the quality?
I believe that. Hello, yes.
Yeah. Hope the question was clear. What are the area and the storage specifications required for starting a pharmacy in Australia? How the quality of the marketed drugs are ensured?
Quality of the drugs, when it comes to quality of the drugs, it's already ensured by the TGA. So there is only 3 suppliers in Australia. So, I mean, wholesalers. So you need to get these wholesalers. You need to get medication only from these wholesalers, and they get approved from the TGA. Nobody can bring drugs or medications from overseas without any TGA approval. The TGA approval is very, very lengthy process. I give an example, like Cipla wants to bring one generic for Seretide, like for the asthma medication. The application fees itself is 100,000, just the application fees. Whether they will reject, that's a different issue. Once you get this approval, then there are a lot of requirements. Sometimes the officials can go to India and check their industries. So there's a lot of checks. So it's not like a easy pathway. So there is no, it's everything straightforward. So once you get the approval, it's like 100% secure. Like the medications are 100% secure. That is the answer for that part. Starting a pharmacy is a big thing. Like it's involved. It's a lot of factors. As I said, location rules. Most people buy a pharmacy than start a pharmacy. That's more easier way. But you need finance, but that's more easier way. Starting is possible, but you have to follow a lot of requirements that you will come to know once you become a pharmacist here.
Haniva sir?
Hello. Yeah.
Hello,
any questions from the audience? Okay.
The moderator, please, Kiran Kamath, daughter of our Suresh Kamath sir, wants few, some points he has to add. Yeah.
Okay. If there is no further question to Mr. Deepu, then we'll move on to Kiran Kamath sir's. Kiran Kamath, daughter of Suresh Kamath, sir. She want to share her experience. So I cordially invite Ms. Kiran Kamath.
Hello.
Yes, it's audible.
Okay, can everybody hear me?
Yeah.
Good evening, everyone. My name is Kiran Kamath. I'm from Goa. I just wanted to share my experience about Australia. I studied my master's. I did my Bachelor of Pharmacy in Goa, and I studied Masters of Good Manufacturing Practice in University of Technology, Sydney, back in 2016. I had no idea about CAPS back then, and I only thought industry is the only option. And after my studies, I joined a pharmaceutical company, which was more like a corporate job in quality assurance in 2018, which was also based in Sydney. So my experience was good. I just saw a question in the chat. Someone was asking about salary. So I started off at $65,000 per annum. But I had friends who have worked up to $90,000 as a starting package. So that is in quality assurance and regulatory affairs. And as per job opportunities, quality assurance and regulatory affairs jobs are more in the cities than regional compared to community pharmacy, where rural has more options. But my drawback was I didn't have a longer term visa, which is why my contract was over before my visa got over, and I had just taken a break to come back to India. And then because of COVID, I was kind of stuck here and my visa got exhausted. So coming to what Sir said, I did my CAPS exam in October 2021. It was a tedious process. Like, I was working as a quality assurance in Goa here, as well as managing studies, but it was a very good experience. I cleared my CAPS. I have applied for my provisional registration. I'm currently looking for an internship. So what's happened is my visa was exhausted in 2020 during COVID. So my visa got enlivened last month for about 6 months. So I'll be traveling to Australia, that is Victoria, in another week's time. So to all the pharmacists out there who are trying to get into Australia, even my friends have suggested this is the best time to try, because due to COVID and the vaccination drive, the opportunities are more. I'm also being hopeful about the same. Yeah, that's it.
Thank you, Ms. Kiran.
And I had a question for Sir, if she doesn't mind.
Okay, please carry on.
So Sir, I just had a question for you. Like, I got a visa last month, and I know the interns are taken usually during the first 2 months of the year, that is Jan and Feb. I just wanted to know if I'm too late to apply for internships. I've been trying sitting in Goa, but I understand the value of being onshore than offshore. So I just wanted to understand if it's going to be very difficult trying for an internship. And having said, I'm trying regional areas. I'm not planning to go back to city at the moment.
It's not very hard at the moment because of the situation, as you said. Suddenly there occurred a shortage. Shortage means it's a massive shortage, and so they are taking interns in every in every suburb. I mean, it's not only in rural, even in cities. Like, there are students whom I met, even I think 2 months back, they got an intern position coming up at any time. So it's not like they take in a different, it's not advertised. That is the one thing. So only 20% of jobs are advertised. To be honest, there's no advertisement done for internship in the Seek or websites or anywhere. You have to go to each pharmacy, meet the owner or manager and give resume. You might get one contact from 100. So that's what everybody is doing. If you're I'm talking about when you are inside this in Australia. So once you start exploring, you will get many contacts. And until now, there is not even a single person who haven't got internship. They will get it after 1 month, 6 months, or 1 year. But I haven't been with at least one person who haven't got internship if they are in Australia. So it is possible. And even rural areas, it's very easily possible at the moment.
Okay, I had another question about, like, I've heard Chemist Warehouse hires interns the most. What's the difference between Chemist Warehouse chain and like the independent pharmacy or the local pharmacy? Like, how different is the internship in these two places?
Chemist Warehouse, actually, when you say Chemist Warehouse, most of the pharmacies don't like them because they are like discount pharmacies.
Yeah.
And they actually like what you call when you say Reliance in India. So it's a big group. They come and make it very cheap, but their intern training is very excellent. So they give a good intern training, and one can do a very good internship. But most people don't stay there after some years because of the overload of work, because their prescription turnover volume is so high, like 3 or 4 times.
Okay, so you would suggest I come on shore and try to personally meet the pharmacy owners and try to gain contacts.
Yes, that's right.
Internship.
That's right.
Thank you so much, sir.
No worries.
Okay, thank you. Another one more question is there regarding the PharmD graduates, whether they need to appear CAPS or is there any other option for them for PharmD?
First of all, there is no PharmD in Australia, so they don't know whether PharmD or B Pharm or M Pharm. They don't differentiate between them. So they read only B Pharm. So once you pass B Pharm, it's became PharmD or M Pharm. Everybody follows the same. So CAPS is needed. In other words.
So for PhD also same.
Yes, yes, definitely. You a PhD with even with 20 years of experience doesn't matter. They have to go through the CAPS pathway.
So any more questions?
Sir, I think there is a question from Sonu Benny.
Could you please read
through that?
I missed it.
Sonu Benny, you can directly ask the question now. Sonu?
Yes, sir. Yes, sir.
Sir, can you please share your comments regarding PDF and that question you can answer? Sonu?
Yes, sir. Should I read it, sir?
Yeah.
Yes, sir. Sir, can you please share your comments regarding PDF and research options there? How to apply and get into it? How can we know about these opportunities? Any platform like LinkedIn?
Research options. When you say research options, there are two options. One is industrial area and the other one is university. The universities are the most entry point. So if you go to the university websites, let's say Monash University or Sydney University, whatever university, and there will be career options, and click that career options and have a look into the research. That's the only way I would think about research options. Apart from that, there are pharmaceutical industries who offer the research positions, but as I said, it's very competitive. So you need to be in Australia to get into those positions. The best way if you want to go do the research is always university. So look into the university websites like Monash University and look into the career options and research facilities and research career options here.
Okay, thank you, sir.
Any more questions? Okay. There are no more questions, then I think we'll wind up the session with a vote of thanks.
Excuse me, sir.
Yeah, please.
Sir, if we go through any, any industrial companies for work, can we gain a visa, sir?
Industry company, if the company is sponsor, yes, 494, there's a sponsorship. Anybody can sponsor. If the company is happy to sponsor, then it can, but otherwise it's very hard.
How about the work opportunities, sir, now to B Pharmacy courses?
You talking about industry pharmacy?
Yeah, sir, in India.
So, sorry, I didn't get the question.
Sir, do we have opportunities in India for industrial work, sir?
India.
No, he is talking about
moderator,
Australia. No?
Moderator, sir, you can involve in that.
This topic of today is the opportunities in Australia. Okay.
Sir, India, we will conduct another one soon in the series.
Okay.
Yeah. Let us wait for that.
Yeah, thank you, sir.
Okay. Sri Kumar sir, shall we?
Yeah, please. Yes.
Okay, thank you. Back to Sonu.
Thank you, sir. So let's thank our more knowledgeable speaker, Deebu sir, and the efficient moderator, Hanifa sir, for the wonderful moments. Now, I would like to invite a budding pharma professional, Ms. Sauparnika Teresa Sabu, Assistant Professor, Edithan College of Pharmaceutical Sciences, Trivandrum, to propose the vote of thanks. With much happiness, over to you, ma'am.
Sonu, am I audible?
Yes, you are audible.
Okay, thank you. Good evening, all. It gives me an immense pleasure to deliver the vote of thanks for this event to all the dignitaries assembled here. I'm so grateful for this opportunity. First of all, I would like to congratulate all the executives of KPGA for conducting such useful webinars for all the pharma professionals from Kerala. I also thank all the attendees, including the senior faculties, students, and other dignitaries who have joined through Zoom and YouTube platform and make the session a huge success. Thank you all. Next, I would like to thank today's invited speaker, Mr. Deebu Prabhakar, registered pharmacist, Australia, for sharing his knowledge and experience of pharmacy profession in Australia. He gave us a broad view on various aspects of pharmacy profession, also mentioned about the various career opportunities and study options for overseas graduates. Thank you, sir. Thank you for sharing your knowledge and experience with us. Next, I would like to thank Dr. Mahalakshmi R, Drug Inspector, Office of the Assistant Drug Controller, Thrissur, for delivering today's welcome speech. Thank you, ma'am. Next, I would like to thank Dr. Padmaja Madam, immediate past president of KPGA and former head of the College of Pharmaceutical Science, Government Medical College, Trivandrum, for chairing today's session. Thank you, madam. Next, I would like to thank Dr. Bobby Jones G, Professor of St. Joseph College of Pharmacy, Cherthala, for giving today's introduction to the module. Thank you, sir. Next, I would like to thank Professor Dr. Muhammad Hanifa, Principal of Maulana College of Pharmacy, Perindalmanna, Malappuram, for moderating today's webinar. Thank you, sir. I also thank Ms. Sonu Beni, who is the master of the ceremony of today's program. And last but not the least, I would like to congratulate KPGA once again for all the conducting all this very useful webinar sessions for all the pharma professionals out here, including Dr. P.K.C. Gumar sir, President of KPGA, Abdul Nasir sir, General Secretary, Dr. Sadish Kumar CS, Dr. Nishit sir, Mr. Abdul Samad, Vice President of KPGA, and all other dignitaries who are a part of the KPGA for conducting all the sessions. I also congratulate KPGA for coming up with new projects and innovative ideas for upgrading our profession in our own home state of Kerala. Thank you once again, and I wish you all with good health and luck.
Thank you so much, ma'am. Once again, let's thank our eminent speaker of the day, Mr. Deebu Prabhakar, for the wonderful opportunity and for sharing the valuable knowledge. On behalf of KPGA, I would like to invite all of you for the upcoming webinar on registered pharmacists in UK, how to become one, and other career options on 3rd of April 2022 by Mr. Ajit Adai. Once again, I'm thanking you all for your valuable participation throughout the webinar. Let's all stand for National Anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thanking you all once again. Stay safe. Thank you so much.
Thank you all. Good night.